Hello, nice talking to you and seeing you all. I'm Gerald Semaganda, speech therapist and audiologist. Yes.
What exactly are you working on?
We do two things, like I've told you, I have two professions. First of all, I'm a speech therapist. Speech therapists work with persons that have difficulties with their speech, that can be coming with delays, speech delays in children, could also come with stroke, people that have had stroke and cannot talk anymore. It has a number of disorders like autism in children, Down syndrome, any kinds of syndromes that would bring speech delays. We work on those. We also work on dysphagia issues, swallowing and feeding issues, and also work on aspects like voice disorders, that is in line with speech therapy. Then audiology, we do hearing assessments, screenings in children, do audiology tests, that is PTA team, just general body ear checkup, and do rehabilitation with hearing aids. Then we also do noise protection, those that have exposure to noise, especially those working in industries, and also do swim plugs, those that are always for swimmers.
Okay, I'll start with speech. You talked about speech, and we have people who cannot actually speak.
Yes.
Can someone be able to speak after maybe you find him at an older age, maybe 10, 15, and they're not able to speak? Can you diagnose them when they're able to speak again?
Okay, thank you for that question. Speech is a process, it's a development, especially during early stages of life, for the time a child is born. So their brain are always easy to be flexible, learn speech, and also grasp whatever they are learning in their environments. So most of whatever we do especially comes of effect in children before the age of preferably 4-5 years. After that, most of the time it goes beyond a delay, and we call it a disorder, whereby a disorder could be hard to get elevated or get better. Yeah, disorders always take time. Delays are easier to work with. Delays, we give it up to 3-4 years. Yeah, for that is for children. And for aspects of stroke, those that are adults have had stroke, it is always easier the first 6 months of the stroke, and also the severity of the stroke could also matter with what the prognosis would be. Yeah. But for kind of children above 5 years, most times it takes a big kind of time to get the problem off, but it will also depend on how much input those people get, especially in their communities around them. So it's very important. First of all, some people take on self-medication. I've seen a number of people coming to clinic that have not been hearing, but happen to always first use eardrops, go for medications and all that. But first of all, it is important to consult a specialist, perhaps an ENT specialist, an audiologist, to get to know what the problem is, get yourself assessed with different tests we've talked about.
My name is Jackson Imbusi, and I'm an audiologist. Audiologists are people who specialize in hearing assessment, screening, and rehabilitation. We are here doing an activity for RIHI, Health Center 4. What you see in front of me, instruments or equipment we use for hearing testing. As you could see, two people are in front of me. Both of them slightly old. As we get old, our hearing also gets down, deteriorates. And that's a natural phenomenon, but there are so many causes of hearing loss, which we are trying to address as Pure Tone, Uganda. If we find out after the tests and we have investigated that everything leads to that, just like people who have got eye problems, many people have hearing issues. Hearing loss can happen anytime. Onset is depending on the condition. Some people can get accidents, others are born with hearing loss, others acquire it along the way. What I could say is every 10 people we find walking or moving around, at least one of them has got a hearing loss of some extent. Some of it is mild, some of it is negligible, some of it is one side of the ear or the other. So I can't say it's the village for everyone. And actually, we are meant to have, just like you go for an eye checkup or dental checkup, hearing health care has now become a big subject where we need our people to annually go for checkups like any other body checkup. I'm not sure about the age bracket, but when we are 40 years old, actually when we are 25 years old, our hearing is at its top. Yeah, the curve goes down as we get older. After 40 years, everyone should go for a hearing test. And what we have discovered is after 40 years, people will have issues. We can't say this is the age bracket, but there are certain causes, of course, which we try to address. People who listen to a lot of music, the youth, should avoid being in noisy areas or noisy environments. Even now, factories, we are encouraging factories to limit their working hours for their workers because there is noise-induced hearing loss.